Good morning, students. We are discussing about the diseases complicating pregnancy. We already discussed disease of CVS during pregnancy, liver diseases during pregnancy, tuberculosis in pregnancy. Now the fourth condition is diabetes in pregnancy. We all know about diabetes mellitus, also known as hyperglycemia, characterized by increased blood glucose level. Today we are discussing about the features of diabetes in pregnancy. What is the effect of diabetes in pregnancy? What are the signs and symptoms? What is the cause of disease, complication, management, etc. Number of diabetic patients are increasing nowadays, especially in India. Patients are increasing day by day. Similarly, diabetes in pregnancy also increasing. Diabetes in pregnancy can be grouped under two categories. One is pre-gestational diabetes and the second one is gestational diabetes. Pre-gestational diabetes means diabetes starts before the pregnancy. Gestational diabetes means diabetes detected or starts during pregnancy. Pre-gestational diabetes is similar to diabetes of general population. Here there are two types of diabetes mellitus, that is type 1 and type 2 diabetes. Regarding the definitions, gestational diabetes mellitus means any degree of glucose intolerance with onset or first recognition during pregnancy. So here diabetes is first recognized or it starts during pregnancy, then it is known as gestational diabetes mellitus. Pre-gestational diabetes mellitus, as the name indicates, diagnosed when the woman has diabetes before pregnancy. About 90% of diabetes in pregnancy is gestational diabetes. Gestational diabetes generally occurs in later half of pregnancy, generally after second trimester. Here diabetes detects during pregnancy. Before pregnancy it was not detected, and the main feature is it resolves after delivery. So diabetes mellitus starts during pregnancy and lasts for throughout the pregnancy and resolves after delivery. That is called gestational diabetes mellitus. The important points are hyperglycemia of the mother affects the fetus also. Glucose crosses the placenta, but maternal insulin does not cross the placenta. Therefore, glucose level in infants also increases. Insulin level in infants also increases. That leads to fetal hyperglycemia and rise in fetal insulin secretion. Moreover, pregnancy is a state of insulin resistance, especially towards term. If there is any difference between gestational diabetes mellitus and pre-gestational diabetes mellitus, or what is the importance of differentiating between gestational diabetes mellitus and pre-gestational diabetes mellitus, it is important because the management and the complications are different in pre-gestational diabetes mellitus and gestational diabetes mellitus. In gestational diabetes mellitus, both mother and fetus are affected, but mothers are at high risk. There is a chance of development of type 2 diabetes mellitus in future in mother. Adverse obstetrical outcomes. But pre-gestational diabetes mellitus, it also affects both mother and fetus, but here the risk is more to fetus. There will be growth restriction and there will be complications during organogenesis. Since pre-gestational diabetes mellitus present the beginning of pregnancy itself or during the first trimester is said to be the period of organogenesis. Organs of fetus are formed during first trimester. So if diabetes mellitus present during first trimester, or in case of pre-gestational diabetes mellitus, that will affect the organogenesis. Next, let us see more about gestational diabetes mellitus or GDM. As I said earlier, pregnancy is a state of insulin resistance. Therefore, during pregnancy, there is decreased glucose utilization due to insulin resistance that will lead to hyperglycemia. And this hyperglycemia or glucose crosses the placenta and it reaches the fetal blood, but insulin does not cross the placenta. So there is an increased blood glucose level in fetus blood that will result in increased insulin production from the fetus. We know that insulin is a growth factor. Therefore, due to the increased production of insulin, there will be increased weight of the fetus. That condition is called macrosomia, increased weight of the fetus. We have seen that pre-gestational diabetes mellitus is associated with a defect in organogenesis. So, if diabetes mellitus detected in first trimester, what is the importance of diabetes mellitus in first trimester? If a woman detects diabetes mellitus during first trimester, it is considered as a pre-gestational diabetes mellitus and should be treated similar to the pre-gestational diabetes mellitus, because the hyperglycemia during first trimester, there will be high risk of congenital abnormalities in the fetus. It is better to screen all pregnant ladies for gestational diabetes mellitus, even though there are certain high risk group for gestational diabetes mellitus. It includes BMI more than 30, first degree relative with diabetes mellitus, patient with a personal history of gestational diabetes mellitus or a history of diabetes mellitus with previous pregnancy, previous macrosomia or previous baby had a weight more than 4.5 kilogram, family origin with a high diabetes prevalence, previous poor obstetric outcomes. All these are high risk groups. Let us see the characteristic features of pre-gestational diabetes mellitus. It is of two types, type 1 diabetes mellitus and type 2 diabetes mellitus, that is insulin dependent diabetes mellitus and non-insulin dependent diabetes mellitus. In pre-gestational diabetes mellitus, preconception care is essential. If untreated in first few weeks of gestation, it is associated with spontaneous abortion or birth defects. If untreated during second and third trimester, it is associated with fetal macrosomia and metabolic abnormalities, birth injury, maternal hypertension and preeclampsia. There is increased chance of future diabetes mellitus or obesity in child. It is a challenge to detect the asymptomatic mothers with diabetes mellitus. Many of the pregnant women with diabetes mellitus are frequently asymptomatic. So, they need to be identified before harm can come to the fetus. It is better to test routinely for all pregnant ladies for diabetes mellitus. How can we diagnose gestational diabetes mellitus? It is characterized by hyperglycemia or increased blood glucose level, even though there are certain criteria put forward by WHO. According to WHO criteria, gestational diabetes mellitus is diagnosed if the plasma glucose is 140 mg per deciliter or above 2 hours after intake of 75 gram of glucose. The 75 gram of glucose is called glucose load. So after intake of glucose load, if the plasma glucose level increases 140 mg per deciliter or more, then it is diagnosed as gestational diabetes mellitus according to WHO guidelines. There are certain other guidelines are also following nowadays. In 2013, WHO dropped its own criteria and accepted the IADPSG criteria. IADPSG criteria means International Association for Diabetes in Pregnancy Study Group, IADPSG. In India, we are following Another criteria that is called a DIPSI criteria or DIPSI guidelines. DIPSI means Diabetes in Pregnancy Study Group of India. DIPSI, Diabetes in Pregnancy Study Group of India. According to this criteria, 75 gram of glucose is taken and blood glucose level is monitored after 2 hours. If the blood glucose level is more than 140 milligram per deciliter, it is called gestational diabetes mellitus. So if blood glucose level increases after taking 75 gram of glucose, if we examine after 2 hours, if the blood glucose level is equal to or more than 140 milligram per deciliter, it is diagnosed as gestational diabetes mellitus. If the blood glucose level reaches more than 200 milligram per deciliter, then it is considered as a pre-gestational diabetes mellitus. The usually adopted way to diagnose a gestational diabetes mellitus is a glucose tolerance test, GTT, otherwise known as OGTT, oral glucose tolerance test. It is a frequently asked short question, so you study it very carefully. OGTT, otherwise known as oral glucose tolerance test. This is the first line diagnostic test for gestational diabetes mellitus. Initially, this technique was developed to identify the diabetes in general population, but nowadays this is used to diagnose gestational diabetes mellitus, because there are several diagnostic criteria are using nowadays. Among these, the most acceptable criteria is the OGTT, oral glucose tolerance test. It is a simple procedure. 75 gram of oral glucose is given. 3 readings are taken: fasting glucose level, 1 hour and 2 hour post glucose level. Routinely, this test is done in asymptomatic pregnant woman in 24 to 28 weeks of gestation. If a lady is already diabetic or a pregnant woman is with over diabetes mellitus, there is no need of conducting this OGTT. An asymptomatic pregnant lady during 24 to 28 weeks of gestation, OGTT is routinely conducted to diagnose the possibility of gestational diabetes mellitus. OGTT should be performed in the morning after an overnight fast of at least 8 hours. First of all, fasting blood glucose level is monitored, then 75 gram of oral glucose is given. After that, 2 more readings of glucose levels are taken, 1 hour and 2 hours after the glucose intake. This is the procedure. And the diagnosis of gestational diabetes mellitus is made when any of the following plasma glucose values are exceeded. If fasting blood glucose level exceeds more than 92 milligram per deciliter, or 1 hour postprandial glucose level exceeds 180 milligram per deciliter, or 2 hour postprandial glucose level exceeds 153 milligram per deciliter. If any one of these observations are occurred, it is considered as a gestational diabetes mellitus. Actually, this is the IADPSG criteria to diagnose gestational diabetes mellitus. IADPSG means International Association for Diabetes in Pregnancy Study Group. Another method to diagnose the gestational diabetes mellitus is HbA1c, detection of HbA1c. If the value of HbA1c exceeds more than 6.5%, then also it considered as gestational diabetes mellitus. Next is the management of diabetes mellitus in pregnancy. Management issues are patient education, medical nutrition therapy, pharmacological therapy, glycemic monitoring, fetal monitoring by ultrasound, planning on delivery. In pre-gestational diabetes mellitus, pre-pregnancy counseling is very important. It is to assess the suitability for pregnancy, to look for complications of diabetes, evaluate and treat complications prior to onset of pregnancy, to achieve optimal control prior to and during very early pregnancy, to provide an opportunity for pre-pregnancy advice and folate supplements. In pre-gestational diabetes mellitus, medical assessment should be done, medical history and current medical management plan, medical assessment to exclude the common complications of chronic diabetes mellitus like retinopathy, nephropathy, neuropathy, etc. These are the common complications of chronic diabetes mellitus. In case of pre-gestational diabetes mellitus, we have to rule out this possibility of these complications, and we have to manage it before the pregnancy itself. In pre-gestational diabetes mellitus, we have to look forward for the comorbid conditions commonly associated with diabetes mellitus like hypertension, coronary artery diseases, hyper or hypothyroidism, autoimmune diseases. Better to rule out all these comorbid conditions before the pregnancy itself and manage it as early as possible. Regarding the general management, we have to give advice for the general management of diabetes mellitus. The pregnant lady should follow a strict diet regimen, avoid concentrated sweets and highly processed foods, avoid soft drinks, ice creams, cakes, etc. Restrict the use of carbohydrates, small frequent meals 4 hourly. It is recommended instead of larger, fewer meals. Reduces the amount of insulin needed at any one time, resulting in lower glucose excretion. Breakfast should be especially small and low in carbohydrate content. High fiber and low glycemic index food are recommended. Food rich in antioxidants play a role in reducing the incidence of fetal anomalies. And one of the main part of management of a gestational diabetes mellitus is rule out the congenital abnormalities of the fetus. We have to do the ultrasound scan to detect the congenital abnormality at the earliest. So the aim of management of gestational diabetes mellitus is not simply to reduce the blood sugar level, but we have to manage the patient. Detailed ultrasound scanning is recommended to detect the fetal anomalies. Nuchal translucency scan, it also to detect the fetal anomalies. Fetal echocardiography, serial growth scan, monitor fetal well-being. And the aim is to carry out the vaginal delivery between 38 to 40 weeks, even though 50% of cases needs cesarean because of increased weight of the fetus because of macrosomia. Aim of management is to prevent the complications of gestational diabetes mellitus. The important maternal complications of diabetes mellitus are preeclampsia, recurrent infection, especially vaginal candidiasis and urinary tract infection, polyhydramnios, anomalies, abortion, sudden intrauterine death, and along with the other complications of diabetes mellitus like retinopathy, nephropathy, neuropathy, micro or macro angiopathy. The important complications in infants include spontaneous abortion, stillbirth, congenital malformation, neural tube defects, cardiac defects, caudal regression, etc. Macrosomia, one of the common and important complication of gestational diabetes mellitus. Macrosomia means increased weight of the fetus. The other complications of fetus includes asphyxia, birth injury. It is also due to increased weight of fetus. Birth injury like shoulder dystocia, Erb's palsy, diaphragmatic paralysis, facial paralysis, etc. Gestational diabetes mellitus, if occurred in the first trimester itself, it usually affects the fetus and result in congenital abnormalities of the fetus. If gestational diabetes mellitus present during the later months of pregnancy, then it will affect the fetus in form of macrosomia, that is increased birth weight, and the complications associated with the macrosomia. Students, this is a brief description about diabetes mellitus in pregnancy. You should read your medicine textbook also to know the pathology, general complications, general management of diabetes mellitus. Thank you.